Hello and welcome to Ask Dr. Dora. I'm Dr. Dora Dixie, board certified in family medicine and addiction medicine. Ask Dr. Dora is my virtual medical ministry that will be used to share knowledge about the magnificent bodies we live in. Knowledge is power, and the more knowledge we have about how the body functions, the better care we can give it for improved and hopefully optimal health. A slogan from the American Society of Addiction Medicine is treat addiction, save lives. The best treatment for any disease or problem is prevention. Alcohol use commonly begins during adolescence, and the earlier a person starts to drink, the more likely they are to escalate. Prevention strategies that seek to delay and prevent alcohol use among adolescents are important. If a teenager does not begin drinking until after the age of 18, they are less likely to develop an alcohol use problem. Parents, I encourage you to talk to your children about the problems that can ensue. Set healthy examples for drinking in moderation and focus on preventing or delaying the initiation of alcohol use. Tell your children about fetal alcohol syndrome or fetal alcohol spectrum disorders. When I was in grade school a long time ago, there were public health announcement film clips shown in school and on television. I still remember the ones on exercise, eating a healthy breakfast, and dental hygiene. Parents, you have a cell phone with video capacity. Create your own announcements for your children. Don't wait, because the average age most youth try alcohol for the first time is 14. That means some start even younger. When social or recreational alcohol use has developed into a disorder, then it's time for professional help. If you have withdrawal symptoms, when not drinking, or when you're trying to cut down, detox treatment can be completed successfully as an outpatient or an inpatient. For severe withdrawal symptoms with a history of seizures and delirium tremens, an inpatient setting is recommended. I told you before, don't tell a person who gets seizures and severe withdrawal symptoms to just stop. Instead, take them to treatment and stay with them until they are admitted for detoxification. The acute withdrawal symptoms usually last 3 to 6 days. The post-acute symptoms, or PAWS, which includes anxiety, cravings, depression, difficulty focusing or thinking, fatigue, unexplained chronic pain, insomnia, irritability, low libido, and nausea, accompanied by other stomach symptoms. PAWS is one of the major causes of relapse or returning to drinking. Detox is not treatment. It gets you in a mental and physical space for treatment to begin after detoxification. Treatment includes from the most restrictive to the least restrictive settings. Residential treatment for 7 days to 90 days. Outpatient treatment for 1 to 12 months. Self-help meetings can be live or virtual. The gold standard and the first is Alcoholics Anonymous. Mental health counseling, as needed, is recommended. Pharmaceutical therapy can be prescribed by a medical provider. There are only 3 FDA-approved drugs to treat alcohol use disorder. Disulfiram is a pill taken orally. It's commonly known as Antabuse. It interferes with the metabolism of alcohol, and if you drink while taking it, you can get violently ill. Naltrexone is either taken orally or as a long-acting monthly muscle injection. It does not make you sick if you drink while on it, but it blocks the pleasurable high associated with alcohol use. A compressate is also taken orally 3 times a day. It is intended to decrease the cravings for alcohol. Remission is defined as sober off alcohol initially for up to 3 months. Early remission is 3 months to 1 year, and sustained remission is 1 to 5 years of not meeting any alcohol use disorder criteria, except for maybe craving. Recovery is often marked by the continued fulfillment of basic needs, with improvements in social support, spirituality, physical and mental health, improved quality of life, and general well-being. If you have a problem or know someone who has an alcohol use disorder, encourage them or yourself to seek treatment. Offer to take them to treatment, and please stay with them until they are admitted, and please don't play the shame game. Obstacles or barriers to seeking treatment are grouped into 5 categories. Stigma, that includes shame and fear. Attitudinal, I should be strong enough to handle it, or there's just no help for me. Readiness to change, not there yet, or the consequences aren't bad enough yet. Financial obstacles and structural, such as no transportation. I can't get to where I need to be to get the treatment. The number one obstacle to treatment is the pride-filled attitude that the person thought they should be strong enough to handle it alone. People, treatment works and saves lives. The national helpline known as the Treatment Referral Routing Service is 1-800-662-HELP. Like I always say, knowledge is power. Thank you for joining me on another informative episode of Ask Dr. Dora. If this episode generated questions, please email them to me at askdrdora@gmail.com, and I will answer soon. Please tell your social network about me. Then like and subscribe to Ask Dr. Dora on all social media platforms. Thank you.